Hello, I'm Linda White. I'm a longtime Deaconess team member. I'm very proud of that. I'm also proud of the bracelet that I wear every day, because this reminds me of the Deaconess care that I received after receiving a diagnosis of stage 4 ovarian cancer. It wasn't that long ago. When I heard that diagnosis in the emergency department at Deaconess Midtown on a Friday night, my only thought was, Deaconess is going to help me. And Deaconess came to my help in every stitch of the way. I had a 9-hour surgery at Deaconess Gateway. I ended up in the ICU. I underwent 18 chemotherapy rounds. I had a port in my abdomen. I have a port in my collarbone right up here. I see Dr. Schumann on a regular basis, and I've got a clean bill of health. In fact, it's better than what I ever would have expected. And it's because of the people at Deaconess. Whether it be the emergency department, the radiology staff, the surgeons, Dr. Schumann, the 5,000, 10,000 people that are my best friends, I am forever grateful.
I was diagnosed when I was on St. Patrick's Day when I was 14 years old, and my parents made the decision to send me up to Riley Hospital. And I spent about 1.5 years doing treatments up there between radiation and chemotherapy and the surgery I had from the start. That's what kind of led me towards radiation therapy, is that I wanted to be able to help people.
I am a survivor. This year will be 7 years. My cancer was a sarcoma, which is very atypical of adults to have sarcomas. I found it, and within 2.5 weeks, I was having it removed. I mean, 7 years later, it still hits home. I'm still getting checkups, and I still have to go and see my oncologist. So I still struggle with those things every day, but I enjoy what I do because I feel like people, like I said, relate to me, and I can understand where they're coming from and what they're going through.
I was diagnosed in 3 days before my 38th birthday in 2020. And so I started treatment in December of 2020 and finished up in November, the day before Thanksgiving, November of 2021. As a social worker, I did a number of different types of work, and something just made me look at the website at Deaconess to see what was available, and there was an oncology social work position open. It was exactly where I received care. I was like, this just makes sense. Like, I'm meant to do this. So as an oncology social worker, you know, it's not about anyone except the patients when we meet our patients. But every once in a while I'll meet a patient and I can tell just sharing my personal story will help them. So when someone's needing that extra little information, I try to share that, and I think it helps out in the long run.
In June of last year, I was diagnosed with testicular cancer. This came on the heels of my father passing away from multiple myeloma about 11 months prior to that. So that was a shock to our family. And that was treated that summer, and the Deaconess family rallied and was definitely there with me, and it was awesome. And I was declared cancer-free about 2 months later. Then actually last week, I was through my routine scans, was re-diagnosed with the testicular cancer had spread. So I am in the process of, well, I'll actually be having surgery next week to take care of this piece of that. My role in Deaconess, and one of my biggest passions, is the patient experience side of it. With my chart, we want to make sure that follow-up instructions and the paperwork that comes with that is all electronic, so that's something that you're not having to retain, maintain, and hand off to your caregivers that are some of the biggest supporters and contributors to your care. So that's where my role and passion has really been increased with seeing this side of the table in that perspective.
I recently turned 40, and I went for my routine mammogram screening and found a surprise. So without the mammogram, I would have not known that I had breast cancer. I didn't have any symptoms. Did my routine checks, I had no idea. After my cancer journey, I decided that I wanted to work with cancer patients and kind of see if I could help them, because I understand what is happening. So I decided to work in radiation and started in January. I'm just very thankful for my cancer service experience at Deaconess. I feel like I've had the best team this whole time, and I continue to have the best team, and now I work with them.
I am a 14-year survivor. I worked at the breast center when I was diagnosed. When I had my mammogram, they saw that I had ductal carcinoma in situ. That's exactly why I feel like being at the breast center is a great job for me. I can kind of be an advocate for people and let them know, hey, get your mammograms, it's important. We all need to do that every year.
I started actually in oncology in Indianapolis when I was 26. 2 weeks into my job, I was diagnosed with cervical cancer. I had 8 surgeries in a 5-year time frame, and I'm 35 years cancer-free this past January. To see the strides that we have made in oncology, the medications that are being used, and how far advanced that we have come in the 35 years that I've been doing this is great to see. I'm proud of my oncology history and my work. That has been my dream job, always.
In October of 2021, it was actually October 29th, I came in for a colonoscopy, and they woke me up and said that they had found something abnormal. And I ended up going down for additional imaging here at Deaconess, and found out that it had spread and was diagnosed with stage 4 colorectal cancer. Obviously it's different being on the patient side of things, but going through a radiology program, as a student and working in multiple modalities, taking care of patients who have had a cancer diagnosis before, this obviously opened my eyes to the kind of care that we're providing for them, and just the flexibility to be able to have those services here locally, and not have to travel out of town. As a cancer patient myself, I've gone through a lot of ups and downs. They always say that's part of the cancer journey, and that's definitely the truth. Multiple treatments that we've tried, and you have your good days and your bad days, but luckily having a good support system both at home and at work have been a blessing. They're coming out with new treatment plans all the time, and it's encouraging. There's something to keep hope on and just keep pushing forward.
I was diagnosed with stage 3 invasive ductal carcinoma of the breast back in April of 2021. September 30th of 2024, it will be my 3 years from the end of my actual last day of chemotherapy. I had gone through my cancer treatment through the infusion center. Prior to that, I was working both at Midtown and/or Gateway on the orthopedic unit. That after I had gone through my treatment, I just felt like it was kind of like a change, and I really valued the work that the nurses did over at the infusion center. They always made me feel so, relaxed. And if I could provide, that type of support and comfort to any of the patients that are there or the new patients that are coming, I wanted to try and ease their anxiety and make them feel as comfortable there as, the nurses made me feel when I was there.
I found my lump myself on January 4th of this year, and then I had my mammogram on January 17th. We found out pretty quickly, about 2 days later on the 19th, that it was breast cancer. I've been in oncology for 20 years. My first 14 years were in infusion, and then the navigator position came up, so I wanted to try something new. My job is just to make sure that they get through the system without any barriers to care and make sure everything goes as smoothly as possible. Just knowing for that patient that someone is there that's always going to be there constant during that journey is just really, it's just beneficial for us, and it's, it just makes the patient feel safe and secure that they have someone that they can go to.
I have been a survivor for 2 years. It was just overwhelming in the beginning because you're going through, doing the biopsy and the testing, and you're on edge and you're trying to figure out, do I have cancer? Do I not have cancer? What is it? I mean, I was passionate in the beginning with my job, but it's more since I've been on the other end. I understand how they feel, and I can relate to what they're thinking and what's going on, because you have a lot on your plate when you get that diagnosis. And the last thing you're thinking about is, how am I going to afford my medicine? Or how am I going to afford this? So It's a lot to take in, and I can sympathize with patients.
I am really excited to celebrate, almost 8 years of being a breast cancer survivor this July. I just had a wonderful team that I worked with through surgery, chemotherapy, radiation. I had reconstruction. So it was really challenging. But I'm very thankful for just everyone that helped me through it, and it's really made me the person I am today, and especially in working in the field now. Although I'm careful to not, I don't even share it with every patient. I don't want to take away from their journey and their story, but when the opportunity is right, I do talk to patients about that I can relate, to be able to tell them that I've, walked their path and be able to answer questions personally for them.
The end of June, I'll be 9 years from my last treatment. My type of cancer was leiomyosarcoma of the uterus, and it is a very rare and a very aggressive type of cancer. There's a lot to be said also about knowing the people you work with are caring for you. That takes a special person to be able to do that. And they do really care, and it shows in the care with their patients, definitely.
Going through this oncology journey, and it really is a journey, you have a lot more empathy for what other people are experiencing. I am forever grateful. And folks, I'll wear this bracelet to represent Deaconess. So proud of you, and thank you.
I am a survivor.